as we welcome another friend of ours from Broadlawns Medical Center, and this time we are talking the world of sleep and how important it is to get a good night's sleep. We talk about this all the time.
And it's huge in this country as a whole. As a nation, we get way too little sleep, in addition to a lot of other bad things that we do. But this is a big problem, isn't it, Doctor?
Dr. Michael McCubbin is joining us. I'm sorry, Doctor. Go ahead.
Yeah, it is a big problem. I mean, the average person needs about 8 hours of sleep, and gets
now,
about
seriously,
6.5.
do people ever really get 8 hours of sleep?
Well,
with our active and our hectic
with our
schedules?
lives, the average person gets about 6.5, and so we were all a little bit sleep deprived, and then if you add a sleep disorder on top of that, you can run into real problems.
Now, what area of medicine do you particularly specialize in?
Well, I specialize in sleep medicine. That's about 80% of what I do.
And how did you get to that point? How did you get to that area?
I actually started out as a pediatrician and a pediatric pulmonary doctor, lung doctor, and I got into sleep that way. And then became more and more interested in sleep.
As you said, Jason, I feel like this is an issue we're hearing more about worldwide, but it's really coming to a forefront where we're able to do things so that people can get a better night's sleep.
Right.
So what are some of those things that we can do if we, or do people even realize that they're struggling with sleep? I know a lot of times we'll feel it the next day, but how do we know if we're not getting the right amount of sleep?
Well, it depends on the condition, of course, but the first thing is getting enough, is scheduling enough time for sleep. And then having a quiet environment, obviously a place that is comfortable to sleep. Getting the TV and the cell phones out of the bed so that you're not distracted by that. And then trying to get the right amount. If you're having trouble falling asleep, sometimes we can give medications, but we don't like to treat insomnia just with medications.
Right.
If you're really tired during the day, then we start looking in, and you're doing everything right, then we start looking into some of the medical conditions that could cause the sleep problems.
Now, we are learning more and more about Broadlawns. Every time you guys come over, we learn something new about Broadlawns. And maybe you didn't realize that Broadlawns does have an area that specializes in sleep. And how long has this place been open?
Basically, it became open when I came 3 years ago.
So the sleep clinic has been around for about 3 years?
About 3 years. Before that, Broadlawns did do some sleep work. You're on the monitors, you can see this is one of the bedrooms, the sleep rooms where we do some testing.
So basically, we have to come over there and fall asleep for you so you can see what
what's all entailed there.
Yeah, that's if it's a serious sleep condition, we usually do an overnight sleep test, and that is a test where you do come into one of our bedroom areas in the evening, and you're hooked up to monitors to measure your breathing, your blood pressure, oxygen levels, all sorts of measurements.
So they wire you up and you get off?
You have some wires. Most people can still sleep with those, because we're seeing people that are, sleepy during the day because they're having a lot of sleep problems. So, and then a technician is monitoring that in another room. And we can tell if your breathing is normal, if you're moving around a lot when you're asleep, which some people do, and that can disturb your sleep. And then oxygen levels, that type of thing.
What's the one thing you learned a lot when you do these tests on people? What's one thing that jumps out more than anything else?
Well, the most common sleep disorder we see is actual sleep apnea, where a person will stop breathing during the night multiple times, anywhere from half a dozen times an hour to 50 or 60 times an hour.
And that's scary when you hear that. Like you stop breathing while you're sleeping.
Actually stop breathing. It disturbs your sleep, obviously, and then you'll partially wake up and you won't get good, satisfying.
Is that what we
sleep.
correlate with, like snoring, when we hear someone struggling almost to breathe that way?
Most of the people with sleep apnea will have loud snoring and struggle for breath at times.
But you can do something about this.
Yes, we can do a lot for that. For sleep apnea, the main treatment is CPAP, which is abbreviation for continuous positive airway pressure. It's a device where we fit the person with a mask that goes over the nose, and then that hooks into a small really a fancy air compressor, which puts a pressure of air into the nose and the back of the throat, and then that opens up the back of the throat. What's happening with sleep apnea is that as you relax and go to sleep, the muscles will close down and everything will relax and close off.
Yeah, and
this opens it up.
This is the portable device that you might have been hearing about on
Right.
radio over the years, the Transcend device, and you can carry this around. This is battery powered, but the ones that you have are
the ones we
larger.
have, at the bedside are a little bit bigger. They're getting smaller all the time.
And they do have water that you add
They
to
have
them for moisture.
a humidifier that will humidify the air so you don't get too dried out.
Now, we should mention not only is sleep apnea something that makes you obviously very tired during the day, but it's also very bad for your health.
Right. Untreated sleep apnea actually increases the risk of heart attack, stroke, mental illness, depression especially, in addition to just making a person not feel good, being very tired and not performing well. A lot of automobile accidents are from people falling asleep, and accidents at work.
Now let's
fatigue.
go. This sounds all well and good, but there's a lot of folks that are out there saying, "I think I have something going on, Jackie. I think I need to find out whether or not I have a sleep problem." But is my insurance going to cover this? What's going to be covered on this?
Generally, obviously, it depends on what your copay and deductibles are. But insurance. More and more of the insurance, I mean, almost always, 100% insurance will cover part of the testing and the majority of the testing and probably the majority of the CPAP
Of the device itself.
Of the device
Oh, that's
itself.
great to know.
So if someone thinks they might have a condition like this, or they have a partner who's snoring all the time, and you're like, you got to do something before I kill you, do they just call Broadlawns and say, hey, I need to talk to somebody, or maybe do a sleep test? How does that work?
Ideally, we like to have the person talk to their family doctor first.
Okay.
Because there's simple problems that they can address.
Okay.
If they think it's a serious problem, then they can refer it to our clinic and at 282-4015, and if we do an evaluation first and then decide what type of testing to do.
Okay.
See, again, it's amazing how many different things are available at Broadlawns. This is not the same Broadlawns, folks, that you've grown up with.
It's
that you thought you
totally
knew.
different.
It is totally
it's amazing.
outstanding.
Yeah.
Doctor, thank
real
you
happy with that.
so
Thank
much for
you.
coming in. We really
Thank you.
appreciate it.
Appreciate
Thank you.
it.
Thank you.